Welcome. I'm Chris Cooper, Assistant Superintendent of Abilene Public Schools, and I have some folks here with me today. We're going to visit about some of the social, emotional, and mental health needs and initiatives that we've been a part of here in Abilene Public Schools. So we've seen a growing number of students that come to school not ready to learn because of trauma or mental health needs. Social emotional learning needs. So we've been trying to address that in our district for a couple of years. And within the last 2 years, we've added a full-time school social worker, an additional full-time K-5 counselor, and a school resource officer that works throughout the district to try to address some of those needs. This year, we're also a part of 2 mental health initiatives from the state. One is through the legislative branch that we'll talk about quite a bit today. And then another one is through a federal grant that the Kansas State Department of Education administers that helps us get some staff development. So as we go through the morning, or this segment, we'll talk about that. But I'm going to have the folks that are here with us today introduce themselves, starting with Susie Gassman.
Hi, I'm Susie Gassman, the school social worker for the district.
I'm Catherine Irk. I'm one of the K-5 counselors.
I'm Jeremy Lebo. I'm the other K-5 counselor. Sitting to my left is Joplin, therapy dog for the district.
And my name is Twyla Sprouse. I'm the principal here at Kennedy Primary School. And I'm excited to have these professionals here that work with our students, because at Kennedy, with the K-1 students here, it's vital that the students are learning the role, their role in the school, and how things work and the expectations that we have. So the support that we have from the counselors and the social worker is just great, and it's important with working with our families as well. So I'll let the counselors share what they do with our students, K-5, and then Mrs. Gassman will share a little bit about her interaction with the students as well.
Well, I work at Kennedy and at Eisenhower, and Catherine and I do the K-5 guidance lessons in every classroom every week. We try to focus on anti-bullying. We focus on careers a lot. We focus on a lot of character traits, just trying to get students to be, good citizens as they grow into middle school, high school, and adulthood.
So, like Jeremy said, that's what we typically focus our classroom lessons on. Sometimes it will kind of depend on what's going on in the school at that time. So for example, we were getting ready to start careers even here at Kennedy, and what we ended up doing this week was kind of focusing on the expectations coming back from break. Maybe some of the students needed a reminder about how to be responsible, or kind of what the expectations are here at the school. So a lot of times I can be flexible too, kind of based on what's going on.
So I'm involved with all of the schools in the district, but primarily the elementary schools, and I split my time up between pretty much the 3 elementary schools when Mr. Lebo and Mrs. Irk are at the other schools, so we have coverage everywhere. My position is very fluid. If I need to be somewhere on an emergency basis, I can go to that school and try to meet that need. I'm also a resource person for the district. This was a new position last year, so it's kind of been learn as you go. And so I do see students individually as needed, but I also work with insurance type issues and medication issues, just all kinds of things, because there's a lot of need in the area. So
I'll talk just a little bit about the 2 initiatives and then ask these folks to share some thoughts about those as well. So I mentioned the one that's a staff development grant through Kansas State Department of Education is helping us as a staff learn to be effective with students that have trauma in their lives or some mental health needs. And actually on January 21st, we're doing a K-5 all-staff training. Most of that training will be focused on helping us stay well regulated and some mindfulness or meditation that we can then teach kids just to stay calm and in the right state of mind to be ready to learn. So that's an ongoing grant that the state's working with 2 districts in the state, Abilene and Wellington. The other initiative, the mental health initiative, is in 6 areas of the state. We are the only rural area, and it includes here Solomon, Abilene, Chapman, and Harrington. And what that has provided for us is another social worker that does some of what Susie also does, and as she mentioned, But that social worker's main job is to be a liaison between the school system and Central Kansas Mental Health, which is our community mental health provider. So if we have students that need mental health services, that person helps connect all those dots, get the two agencies to work together, takes care of understanding the paperwork and how their system works and how our system works. Currently, we have about 100 of our students that receive either social skills group or professional personal mental health therapy in our schools. So we provide space for the counselors from Central Kansas Mental Health to come here. And that's provided a lot of good opportunities for students and families. It eliminates the need for students to leave school to go to a much needed therapy session, whether that be in town or in Salina. So it cuts down on the amount of time that students miss school. And I'm going to ask these folks to kind of answer how that process works. So if we have, I'm going to ask this question, if we have a student that our staff identifies needs some mental health services, how do we go about connecting them with those professional services?
There you go. Go ahead.
Typically, when a teacher, for instance, would notice that a student might have some concerns with anxiety, perhaps appearing to have some depression characteristics, that teacher would probably contact either a principal or a counselor, and from there we might meet as a team and discuss what we know about that child. From there, we would involve our school liaison person, Shelley Alderson, and if it was seen as necessary, we would then make a connection with Central Kansas Mental Health to start the process of getting that student some service if it was deemed necessary and permitted by the parent.
Okay. Jeremy, since you have the microphone and you have Joplin sitting there, you want to explain, I'm sure people are interested a little bit about what Joplin's role is in mental health and just culture of the building.
Well, Joplin makes people happy, students and adults. It's hard to be angry when he's around. I've had Joplin here for, this is my 12th year in the district. I believe he's been part of that for 6 years. Sit. And when a kid is wound up, anxious, angry, I will oftentimes involve Joplin, and that can quickly de-escalate a student. And that's his primary role.
Would anybody like to share some of examples of what students carry in that you deal with on a daily or weekly basis as far as why we need these supports? Nothing obviously specific, but why do we have this need for more services?
Can I give a scenario?
Sure.
So I had a situation today. There's a little boy in the district who's on medication for hyperactivity, and there's an insurance issue. There's also some, he's switching from another community health center out of the area to Central Kansas Mental Health, and he's running out of meds as of Monday morning. So I contacted the mental health liaison, and she's going to contact the therapist and see if we can't get a Medi-Val set up on an emergency basis so that child can have his medicine that he needs.
So
next week.
Susie, a lot of what you do is work with the family to
I do work with
access.
families. I left that out before, but I do work a lot with the families because, you know, they need to be kept in the know of what's going on with their child. Mm-hmm. And they have a lot to add to what we can do to help the kid at school. So, yeah, I work with families a lot. And as far as resources go, I work with families a lot as far as resources.
Yeah.
So.
Oftentimes when students come in the mornings, we all have things that go on in our lives, and a lot of times it's hard to separate that when you walk through the door of the school. And so it's very important that we help the students, especially here at the K-1 building, learn to express how they're feeling, because a lot of times they don't even know how to express that verbally. You know, students may cry or get upset, get angry, but being able to express the reasons behind that is often very hard for them, especially at this age, since they're just new to the building and new to school in general. So that's where Mr. Lebo and Mrs. Irk and Mrs. Gassman are really good about helping with that, because they have time to pull those students individually and just talk to them a little bit, you know, about what's going on and how they're feeling. And usually just by a short conversation and talking about expressing their feelings, they're able to get back to class and be ready to learn. So it's very, very helpful to have them in the building and a phone call away if they're not actually in the building, you know, at the time. So we're very blessed to have them on staff.
I'm going to toss a question to Catherine here. So you do lessons with the classrooms and also are familiar with the social skills groups when case managers from Central Kansas Mental Health might come in. Can you give some examples of skills that you work with or that they work with elementary kids, just social skills?
Okay, so I think a lot of our students come in and they might not, like Dr. Sprouse said, even at higher levels than here, they may have trouble identifying how they're feeling or like what's bothering them, how to communicate with their peers when something's wrong. So a lot of times just self-regulation skills, kids are really, they tend to struggle with that. Is what I think we've seen here. So learning how to express that appropriately and not, hitting someone or yelling at someone, but how can you do that in an appropriate way? And so we have Central Kansas Mental Health that comes in and does groups, and we have also done some groups as well. Mrs. Gassman and I just wrapped up a couple of different groups, both here and at McKinley, working with students on just how to be a better friend, having good self-esteem, how to communicate, going through some different scenarios of situations that might happen, talking about ways that they could handle those situations. So we just wrapped up some groups regarding those topics, and I know that Mr. Lebo is getting ready to start some groups.
At Eisenhower and here at Kennedy.
Yeah. So we also work with students individually too, so the therapists do come in from Central Kansas Mental Health, but as Dr. Sprouse alluded, sometimes we'll work with students too who might be having trouble with just some stuff that might be bothering them at home, or they might be having trouble making friends, might be mad at their teacher because their teacher asked them to do something and they just think that's very unfair. Just kind of talking about better ways to handle those situations.
Dr. Sprouse, could you share a little bit about the types of data that we collect for behavior and these social emotional needs and to try to make decisions about our programs?
Sure. Our teachers complete a screener 3 times a year. We're using the SABRS this year, and it just gives data on internalizing behavior and externalizing behavior. Excuse me. So it's very good to look at that and be able to see where we can help meet the needs of students, and it helps when identifying students for certain groups, and then obviously when we need to contact Shelley, to the liaison, to help with getting services through Central Kansas Mental Health. But the parent piece is huge, because I don't want to not mention that parents are always contacted. If a counselor or Mrs. Gassman sees a student one time and then we think that they need to maybe talk to them a little bit more, or they need to contact the parent about what was discussed, then the parent always has the right to say yes or no, you can visit with my child more. So the parents are an important piece to this, and the families in general. So, but back to the data, we use that data obviously for the groups, obviously for other information as well, but it helps us as a staff know what's working well in our building and what we might need to change. So the staff development piece that we are participating in on the 21st of January is important as well, because it helps us just evaluate, the things that we have going on in our buildings, the expectations we have, and really make sure that everything aligns with what our students need.
All right. Well, in addition to that, we've talked a lot about K-5. I would just note that from the district perspective, we also have these initiatives going on at our high school and our middle school. We have Central Kansas Mental Health therapists that are, I believe, 2 days a week now at our high school, working in conjunction with our counselors and administrators there as well. District-wide, we look at the screener data, as Dr. Sprouse mentioned. We also track attendances, visits to the counselor, visits to the nurse, and office discipline referrals, trying to just get a handle on where are our needs as a district and how are the programs that we're utilizing working. So this is an ongoing effort in our district. We've been contacted by several other districts that are pursuing similar efforts to try to figure out together how we can be more effective in this process. I would mention that we're very thankful to have a lot of cooperation from Central Kansas Mental Health. They've been a great partner in this, and that's not always the case in all communities. And as well as the City of Abilene and the Abilene Police Department through the School Resource Officer. So we're fortunate to be in a community where lots of folks want to work together to really ensure that kids are ready to come to school, that kids come to school ready to learn. And that's the goal of all the efforts that we talked about, is that kids can be successful in life and in school. And so I really appreciate these folks coming today and sharing, and we are on a continuing journey to try to improve this culture and the life of every child and family that we deal with. So, thank you.